survey results indicate that Nigeria has a HIV prevalence of 1.4% amongst the ages of 15 to 49 years. In fact, Nigeria has the second largest HIV epidemic in the world. Plus, they also have the highest new infection rate amongst sub-Saharan Africa. In fact, it might interest you to know that a lot of people on the street do not even know their HIV status. Today on the program, our focus is on HIV and its key population. My guest today is someone you love to meet that is grounded in this field. Of course, we have a feature too on COVID-19 vaccine. We're all happy to have received COVID-19 vaccine. But the big question is, after you get vaccinated, when does immunity kick in? We have an official from WHO, from the World Health Organization, will be briefing us on what we need to know as regards to that. This is Health Watch, and my name is Nkem Okibe. We'll go on a short break and we'll return you with my guest. Stay with us. My name is Nkem Okibe, and you're welcome to this week's edition of Health Watch.
Those drugs are prescription only, and they are only to be dispensed by pharmacists because we know how they work and we can save you from using it inappropriately.
But at least if you have a cervix, you have a huge chance of never having cervical cancer.
Lack of drug compliance, proper drug compliance. Probably the patient did not take it the way it has been taken.
Glaucoma is the second most common cause of blindness worldwide, and glaucoma blindness is irreversible.
Before a dental surgeon practices anything, the ethics says a patient must go through a dental therapist.
Find out on this week's episode of Health Watch. If you're just joining us, the program is Health Watch, reaching you on the station for excellence, NTA Lagos Channel 10. My guest today is someone who has spent over 20 years in the field of public health, Batholomew Ochonye. You're welcome to the program.
Thank you very much.
Our focus today is on HIV and its key population, but I think we should do the basics first. So what's HIV and what are the modes of transmission of this virus?
So HIV is an acronym for Human Immunodeficiency Virus, and it is a virus that causes AIDS, which is acquired immune deficiency syndrome, and it is transmitted mostly through blood infection, screened blood, having unprotected sexual intercourse with an infected person. Of course, when a mother who is infected can equally pass it on to her baby, which is called mother-to-child transmission, and sometimes it is called parent-to-child transmission because in the course of family relationship there could be sharing of sharp objects between the father or other siblings in the home, and if any one of them is infected, those sharp objects carrying infected blood can equally transmitted the virus. So these are some of the ways by which HIV is transmitted. Basically, sharp objects, unprotected sexual intercourse, which is actually like 80% of the mode of transmission in the country, and then mother-to-child transmission. Those are the very broad area, modes of transmission of HIV.
So when we talk about the key populations, which group is most at risk?
Yes, so when you talk about key populations, key population is a public health terminology which describes populations that are at higher risk, different, from the general population. And for different countries, they are different. For Nigeria, the key populations include people who inject drugs, of course, because of the efficacy of transmission of HIV through direct blood, because sometimes people who inject drugs, they share needles, sometimes they share syringes, which is critical for transmission. We also have sex workers, people who basically sell sex. And why that is critical is because of the number of partners that they have and the frequency of the sexual activities. Then for men who have sex with men is because of the way that the activity happens, because the region that is involved in the activity is actually prone to infection because it is not as easy as it is for the natural heterosexual relationship. So the efficacy of transmission is equally high among them. We also have the transgender persons who, by statistics, have like 40% higher chances of getting infected as compared to the women in the general population. So these are categories of people that are referred to as key population, and they are so defined because the rate of transmission of HIV among this category of persons is far higher than what you find in the general population or the general public, so to say. So they are referred to as key population. In other climes, you have like migrant workers. You know, in other situations, you also have victims of trafficking, because most times when individuals are trafficked and moved from one place to the other, they are either going there for sexual slavery, or they are going there for forced labor, or they are going there for forced marriage, or they are going there for outright, you know, being sold out, you know, for you know, other purposes. So those are also at higher risk. But for the Nigeria definition, those are not actually counted. Those that are counted are those four that I mentioned: the sex workers, the people who inject drugs, the transgender persons, and the men who have sex with men.
Interesting to know that several years before now, once you mentioned it, in fact, you dare not mention HIV because it was everywhere. Everybody had an idea of what it was. But unfortunately, there's a decrease or there's a decline in awareness and sensitization. What would you say is responsible for that?
Yeah, I think that's a very important observation. So there might be two reasons, you know, from my current perspective. One of the reasons could be as a result of the fact that people are getting very familiar with, you know, HIV, you know, with AIDS. People are becoming relaxed. They are not really seeing it as any big deal anymore. So it's in the air, or it used to be in the air all of the time. And so people got to the point where it's no longer news, you know, and so to that extent, you know, you hear there is less emphasis on it, but that does not stop the transmission of the virus. The other thing is statistics has shown, especially for the general population, that the prevalence of HIV, and prevalence means the totality of all those who have the infection, both new infection and old infection. So you have the prevalence, while the incidence is for new infection. So for the prevalence among the general population, it came down from maybe 5.6% down to 5.4, 3.6, and the recent NICE, the National AIDS Impact Indicator Survey, indicated 1.4%. So that means it is coming down. And because it is coming down, there is that tendency to think that, you know, emphasis should be less paid on it. Investment is also going down, you know, because in terms of funding for the response is coming down, you know. So to that extent, there will be less noise, you know, about the HIV pandemic as it were.
I personally think that the awareness for HIV should be ongoing. I know I said so because there's no vaccine, there's no cure. COVID-19 came out in 2019 December, right? Got into Nigeria in 2020, and we already have a vaccine. What's the way forward if we continue to look at the fact that the prevalence rate is coming down? So we should just remain where we are, or there's no need for awareness. So people already know, or people are getting relaxed, so they already know about HIV. Unfortunately, people are walking around the streets, they don't even know their HIV status. What is the way forward, going forward from here?
Okay, that's a very important question, because every day people are getting infected. Every day, as we sit here, people are getting infected every day. I was in one part of Lagos yesterday, and you know, I was informed, part of my program visit, I was informed that somebody came to one of our centers and who was HIV positive. I mean, was just discovered HIV positive and was on the queue for getting treatment. Why I say that is because people are getting infected on a daily basis. Now, the challenge with Nigeria as a country is research, evidence. We are still talking about prevalence, when we should actually be talking about incidence, new infection. Because for those who already are infected, we should talk more about the care and the support they can get. Access to medication, access to treatment for opportunistic infections, access to good nutrition, and so on and so forth. But we should be worried and concerned about the new infection. I told you that prevalence is a combination of both new and old infection. Our worry should be much more of the new infection, because the new infections is adding to the burden of HIV. And like you said in your introductory remark, Nigeria has the second largest burden, next to South Africa. So with that kind of burden, we should close the tap of infection as against, treating people and adding to that number that needed to be treated. We need to spend more time addressing the issue of the new infection. But we don't really have those scientific empirical data about the new infection. So we should spend more time on that, because when you look at the prevalence, we can't even tell you that, okay, if the prevalence is 1.4% in Nigeria for the general population, what percentage of that number is attributed to new infection? So if we know what percentage of that is attributed to new infection, we will gather all our energy and resources and focus it on preventing that rate of new infection. We can even cascade it. What age bracket are more exposed to getting newly infected? What category of persons are contributing to the new infection? One of the studies, which is way back now, mode of transmission studies 2009, showed that even among married heterosexual couples, the prevalence of HIV was as high as a 40% contribution to the new infection among them. So that was mind-blowing. But this is a stable or presumed stable relationship that is going on. So you don't expect the prevalence to be higher among them. So those kinds of studies actually get us, wake us up from our sleep or slumber and get us running and pumping, funding in the right direction. If we are able to do that over time, we'll achieve stability. We'll be able to control the epidemic, as UNAIDS has posited for 2030. We should be able to, stop the epidemic by 2030 and focus on other priorities.
Let's go on a short break. When we return, Health Watch continues in a moment. Stay with us.
As Nigeria joins in the global fight against COVID-19, we must all take responsibility for the health of our loved ones. COVID-19 knows no borders, age, gender, tribe, or state of origin, and most importantly, it has no cure for now. The only way to defeat this unseen enemy is to prevent its spread by obeying the NCDC guidelines on COVID-19. Wear face masks in public places and maintain physical distancing. Wash hands regularly with soap for at least 20 seconds. Do not sneeze or cough into the open air. Instead, use tissue paper or sneeze or cough into your elbow. Generally avoid crowded places. If you develop any symptom, don't wait till it becomes severe. Get tested immediately. Check into an isolation center if you're positive, and remain there until you test negative. COVID-19 is real. Let's fight it together.
This message is endorsed by the Broadcasters Guild of Nigeria, BGN.
Welcome back. If you're just joining us, the program is Health Watch, reaching you on the station for excellence, NTA Lagos Channel 10. And before we went on that break, I told you that our topic today is on HIV and its key population. My guest is still in the house, Batholomew Ochonye. He is the Chief Executive Officer of Heartland Alliance. Before we went on the break, there was something you talked about, closing the tap, the HIV new infections. And one of the questions that came to my mind now is, what has been the impact of COVID-19 on HIV?
Oh, absolutely. So, when COVID-19 arrived, it arrived in a very big way. And there was no shying away from the impact of COVID-19. The impact was very immediate, affecting over 200 countries around the world, and with thousands of people getting infected and dying on a daily basis. And so that drew a lot of attention in terms of focus, in terms of funding, in terms of research, and priorities, policies. Everything has to change. Everything initially came to a standstill, and everything has to change. The lockdown and all of that. You know, for HIV, part of the impact of COVID-19 on HIV is the fact that even the health infrastructure, the health investment, everything now were prioritized towards dealing with the current COVID-19 pandemic, because it's affecting everybody, irrespective of your social, political, or economic status. Also, the already depleted health system and infrastructure we have in the country was now even further overburdened, because now the healthcare providers who were actually covering HIV intervention and all of that now have to reprioritize their effort towards COVID-19. So you find out that doctors, nurses, lab, healthcare professionals, social workers, who ordinarily are supposed to be moving around, providing, refill for drugs, providing HIV testing and all of that, they all now moved and focused their attention towards COVID-19. The other thing is that most of the facilities that were used to provide interventions were providing, below minimal, we are performing below standard in terms of capacity, below capacity, because of the fact that some healthcare professionals got infected and died. Others are even so afraid. I know a lot of healthcare workers who left the country because they felt there was no adequate protection for them. Healthcare workers were begging for PPEs to be able to use to protect themselves. They were getting infected and infecting their families. So a lot of that was happening. The other thing is that some of the community infrastructure that were used for providing community HIV services to the persons who are living with HIV were also affected because movement was restricted. So if I'm supposed to go get my ARV refills, I can't move, especially if I don't have a pass. So it became even more difficult for people to go get their medication. The other area is the fact that the economy was badly affected. And so if the economy is bad, and people living with HIV who are supposed to be eating good food, who are supposed to be living in a clean environment, who are supposed to have access to, some means of livelihood, some persons who have to go out on a daily basis to be able to make ends meet, people who hawk one thing or the other, they are unable to do those businesses, so the income is affected. And once your income is affected, it affects your medication, it affects the food, quantity and quality of food you put on your table, and so on and so forth. So you have a lot of people dying during this period as a result of opportunistic infections, as a result of inadequate care, as a result of the depleted economic situation that they face. So the COVID-19 situation further complicated the existing HIV situation we have in the country. And for key populations, it's even worse. Because some of these key populations don't even have a place they call their home. They end up either in the bus stops or under the bridge somewhere or in the bunk somewhere where the only thing they know is to use drugs.
So in other words, it created more burden. And
further, complicated the already bad situation that we have, even with the key populations. Yeah.
Okay, so having said all of this, what would you say is the current status of HIV response in Nigeria?
Generally speaking, we've made significant progress coming from an era, let me say late 90s, late 80s, early 90s, where it was difficult for somebody to even access medication. That time HIV was like death sentence. Even for media adverts, you see the bones, the skeleton, those scary looking stuff. But it's no longer like that. You see now normal looking, handsome, beautiful people, on adverts and all of that. So there's a lot of human face to the virus. And also the fact that as at then, I know that a pack of drug that you are supposed to take for just 1 month could cost you as high as 75,000 naira. So it's only the high and mighty who were infected that were affording to import their medications and all of that. And even when the drugs started, donors started bringing in the drugs, there were cartels and all of those kind of shenanigans that were going on with even managing those commodities. But right now there's a lot of improvement in terms of availability of the drugs and other commodities. It's also accessible because there are community systems in place that makes it easy for people to go get their medication. That level of stigma that people used to have has also reduced because there is more awareness, even though knowledge is still low compared to, yes, people know HIV, so what? So when you start asking, can you sit and eat with somebody with HIV, God forbid? Can you share the same room with somebody who's God forbid? So that's the difference between awareness and knowledge. So awareness, yes, HIV is real, yeah, HIV is there, yeah. But in terms of now knowing how to deal with it, what to do, so there's a gap there. And that, I'm sure that's where you were coming from earlier on when you asked about the need for more awareness in that respect. So yes, we have moved forward because like I said earlier on, the prevalence was as high as 5.6% for a country, like Nigeria, with a population of course, we are always estimating our population of over 200 million. And you know what that means. Coming down to 1.4%, I think is a significant progress. However, we need to get to a point where we need to control the epidemic. That's where we need to get to.
We've been speaking with Batholomew Ochonye, the Chief Executive Officer of Heartland Alliance. Thank you so much for coming on Health Watch.
Thank you, Kim.
Moving on, we have a feature on COVID-19 vaccine. Yes, the vaccine has arrived in Nigeria, but the big question is, after you get vaccinated, when does immunity kick in? Enjoy this feature, we'll be right back. It's already a year the coronavirus pandemic hit Nigeria, with the emergence of its vaccine as a big relief globally. On the 2nd of March 2021, Nigeria received nearly 4 million doses of COVID-19 vaccine, shipped via the COVAX facility, a partnership between CEPI, Gavi, UNICEF and WHO. This is indeed a historic step towards the goal to ensure equitable distribution of COVID-19 vaccines globally, as well as a sure way to ending the pandemic soon. However, the big question still remains. After taking the vaccine, when does immunity kick in?
The vaccines that we have right now are all 2-dose vaccines. After the first dose, we see a good immune response that kicks in within about 2 weeks of that first dose. And it's really the second dose that then boosts that immune response. And we see immunity get even stronger after that second dose, again, within a shorter period of time after the second dose. We don't know yet how long immunity lasts from the vaccines that we have at hand right now. We're following people who have received vaccinations to find out whether or not their immune response is durable over time and the length of time for which they're protected against disease. So we're really going to have to wait for time to pass to see just how long these vaccines last.
Another question is, can a person still catch COVID-19 after one gets vaccinated and also infect others?
We are still trying to now check whether it can even prevent you from getting infected, and it can also prevent you from transmitting. You will prevent the disease, but you might still be able to transmit. So those are the other two areas where research is still following those who have collected the vaccine. They have received the vaccine, they are following them up so that they want to be sure that they can't transmit it, or they can still transmit, but it is confirmed that it can prevent the disease from coming up.
Let's all bear in mind that the arrival of COVID-19 vaccine is not the end of the pandemic, so don't let your guards down. Take responsibility by following all COVID-19 protocols and government guidelines. And that's the much you can take on this week's edition of Health Watch. Remember the ABC rules to HIV. A for abstinence, B for being mutually faithful to one faithful partner, C for correct, consistent use of condom, And remember that COVID-19 is not a hoax, it's real. Mask up if you must go out. And wash your hands regularly, soap and running water. And in the absence of that, use an alcohol-based hand sanitizer. Remember that health-conscious people live longer. My name is Nkem Okibe. You know I love to do this with you every week. Join us next week on the same station, same time. See you then.